Hey, this is Diego Ruiz Dasilva, dermatologist in Virginia Beach, Virginia for Forefront Dermatology, also an assistant professor at the Eastern Virginia Medical School and associate editor for the JCAD. Excited to be here at the AAD Innovation Academy 2026 in New York City. We had an awesome, jam-packed session on medical dermatology pearls in the afternoon. My particular portion of that was talking about challenging the status quo of lab monitoring in dermatology. Okay, so it's pretty kind of quick and efficient, quick hits in terms of what we talked about. But we talked about lab monitoring for biologics, particularly IL-17s and 23s, and how the National Psoriasis Foundation and the International Psoriasis Council said that we do not need routine TB testing, despite the label being taken from the TNF inhibitors, right? We talked about the rarity of terbinafine-induced liver failure, of serious treatment-limiting adverse events with isotretinoin, with JAK inhibitors, and essentially how we in dermatology we know how to treat severe dermatoses and severe conditions with these medications. Though they may come with real risks, the risks are very low, and there are certain ones where you need careful lab monitoring, and certain ones where I think the lab monitoring not only leads to waste, right, dollars in terms of healthcare dollars, unnecessary worries and further testings for patients who have incidental findings that they end up getting MRIs for, or being referred to like 4 other doctors, and it ends up being nothing or something that self-resolves on its own, or even just the fear, people suffering with their disease because they feel like them having to take a medication or having to do something and need all this monitoring is aggressive or scary. So I think it's up to us as the clinicians to stay on top of the evidence. When something is new, of course, we can be a little bit more cautious, but when we have a lot of real world evidence and expert consensus on these things, we need to be able to adapt with the times as opposed to maintaining the status quo from the past.